Hi guys, this is Jamali Magilena Masalagat, your student nurse from University of Mindanao. For this video, I'll be demonstrating to you how to do catheterization for both male and female patients and how to remove an indwelling catheter. But before we proceed to the said video, let me define first what is catheterization, in which catheterization is the introduction of urinary catheter into the bladder through the urethra for instilling or removal of some fluids. So there are several purposes of catheterization, including first, to relieve urinary retention. Second, to obtain sterile urine specimen. Third, to measure the residual urine remaining in the bladder after voiding. Fourth is to control urinary incontinence. Next is to provide access for instilling medication into the bladder. To maintain empty bladder during the surgery, and the last one is to monitor early production of seriously ill clients. So now let us proceed to step-by-step process of catheterization for male patients. So first, we have to check the doctor's order because catheterization is only done with medical orders. And also, you have to assess whether the client is allergic to iodine povidone because iodine povidone is usually used to cleanse the genital area prior to catheterization.
And next, assemble all the equipment needed, such as bedpan, waterproof underpad. It is improvised waterproof underpad because I don't have waterproof underpad. And bath blanket, pickup forceps, working forceps with soapsud solution, lubricant, betadine, hypoallergenic plaster, sterile water, 10 cc syringe, cotton balls, dry cotton balls, working gloves, fenestrated eye drape, sterile gloves, sterile gauze pad, kidney basin, and French 16 catheter, urine container, and urine bag.
Next, identify the client and explain the procedure that you are going to do. It is to ensure the right client and elicits cooperation. Hi sir, I'm Jamali Magilena Masalagat, your student nurse from University of Mindanao. Ako sa i-check in mong ID band, sir. Okay, sir. Karon, maghimo tag catheterization, sir. Gi-inform na ka sa doctor, sir. Okay, sir. Thank you.
Next, provide good light. Good light is necessary to locate the meatus clearly. Provide privacy. Every client has the right to be protected from being exposed to others.
Next, replace the top sheet with bath blanket.
You also have to place waterproof underpad under the client. This protects the bed linen from moisture and getting soiled.
Next, place the client in a supine position with feet apart and drape the client.
Good visualization of the meatus is important. Draping the client helps to avoid embarrassment and tension during the introduction of catheter. Next, prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. This tubing facilitates in connecting the catheter to the drainage system. Open the cat pack and bring it near to the bedside. Placement of the equipment near the work site increases efficiency, while sterile technique protects the client and prevents the spread of microorganisms.
Squeeze a small amount of lubricant to the sterile area.
Organization promotes efficient time management. Using sterile pickup forceps, get 2 cotton balls, with betadine antiseptic solution from the sterile jar and place them on the sterile field on the top of the OS. Next is hand washing. Hand washing prevents the spread of any microorganisms. Next, put on working gloves. This could help to prevent the cross-contamination of microorganisms. After that, do perineal flushing. Cleansing the perineal area prior to catheterization prevents the introduction of bacteria. After the perineal flushing, discard the working gloves. Do hand washing. It is to prevent the spread of microorganisms.
Next, don gloves.
Putting sterile gloves helps to avoid cross-contamination of microorganisms. Grasp the upper corners of the eye drip and unfold it without touching the unsterile area.
Place the fenestrated drip aseptically over the perineal area with the penis extending through the opening.
It is to avoid cross-contamination of microorganisms, and also a drip provides a sterile field where the equipment and hands will be placed, and it also prevents accidental contamination from adjacent areas.
Hold the penis with non-dominant hand and disinfect the meatus twice using cotton balls with betadine antiseptic solution. Starting from the top, use a circular motion, stroke them downward, and discard. Use the 2 cotton balls with betadine.
Cleansing the area minimizes the risk of urinary tract infection by removing surface pathogens.
Lubricate 6 to 8 inches of the catheter tip and make sure to avoid clogging the lumen.
Lubrication facilitates the insertion of the catheter and reduces trauma to the tissues.
Hold the penis perpendicular to the body and pull up gently. Next, hold the catheter with dominant hand and then steadily insert the catheter for about 8 inches or until the urine is noted in the drainage bag.
Advancing an indwelling catheter an additional 1/2 to 1 inch ensures the placement within the bladder and facilitates the inflation within the bladder and also facilitates the inflation of the balloon without damaging the urethra.
Don't forget to instruct the client to take a deep breath while inserting the catheter. So take a deep breath, sir, ha? Insert na kayo. Do not force the catheter through the urethra.
Making the client relax helps the sphincter relaxes, and when the sphincter relaxes, the catheter can enter the bladder easily.
Okay.
Hold the catheter securely using non-dominant hand while emptying the bladder and collect the specimen about 20 to 30 ml if required and continue drainage according to the hospital policy.
So since we use polycatheter, we have to introduce 10 to 5 cc of distilled water, and with this I am using 5 cc distilled water. That depends on the manufacturers of catheter. Gently introduce.
This helps to create a balloon in the tip of the catheter, and creating a balloon helps to ensure catheter retention and maximizes continuous bladder drainage, and proper attachment prevents trauma to the urethra and meatus from tension on the tubing. Then remove the fenestrated drape.
If the urine is noticed in the drainage bag, put the urobag below the bed. It is to avoid the reflux of urine to avoid urinary tract infection. Remove and clean the equipment.
After that, label the urine specimen and send it to laboratory immediately, because if you keep the urine in a room temperature, it may cause the organisms to grow if there's any, and it can distort laboratory findings. Next, do hand washing. It is to prevent the spread of microorganisms.
After that, carefully record the time of the catheterization, the amount of urine removed, and the description of the patient's urine. You also have to include the reactions of the patient during the procedure or any other observations during the procedure.
A careful record is important for documenting data after the client's care, and all this report must be accurate and timely for continuity of care. Now let us move to female catheterization.
Now let us move to the step-by-step process of catheterization. So first, you have to check the doctor's order because catheterization is only done with medical's order. Identify the client and explain the procedure that you are going to do. Good day, ma'am. I'm Gemaline Maguilan Mamasalaga from University of Mindanao. Karon, ma'am, atong buhaton kay magbuhat ang catheterization. Giingnan na ka sa doktor, ma'am.
It is to ensure the right
Sa
guide
kanatong
and
name, ma'am,
elicit
pa-check sa ko sa ID
cooperation.
band. Next with that, assess whether the client is allergic to iodine, plaster, and latex. Iodine is usually used to cleanse the perineal area prior to catheterization.
Next is assemble equipment needed. It is to promote efficient time management. Provide good light. Good light is necessary to locate the meatus clearly. Next, wash hands thoroughly. Hand washing prevents the spread of microorganisms. Provide privacy by closing the door. The client has the right to be protected from being exposed to others. Replace the top sheet with bath blanket and place waterproof underpad under the client. It is to protect the bed linen from moisture and getting soiled. Place the client in dorsal recumbent position and drape the client. Good visualization of the meatus is important, and draping the client helps to avoid embarrassment and tension during the introduction of catheter.
Place also bedpan under the client.
It is to catch the water while cleaning the perineal area.
Next, put on clean working gloves.
To protect yourself from any spread of microorganisms.
Next, do the perineal flushing procedure.
Cleansing the perineal area before catheterization prevents the introduction of bacteria or spreading of microorganisms. Remove bedpan. Remove and discard used working gloves. Open the cat pack and bring it near to the bedside. Placement of the equipment near the worksite increase efficiency, while sterile technique protect the client and prevents the spread of microorganisms.
Squeeze a small amount of lubricant to the sterile area.
It promotes efficient time management.
Get 2 cotton balls from the pack and place on the sterile field, then let someone pour betadine over the cotton balls.
It also promotes efficient time management.
Put on sterile gloves to prevent the cross-contamination of microorganisms. Next, grasp the upper corner of the fenestrated drape and unfold it without touching the unsterile areas. Place it over the vulva, only exposing the needed area.
A drape provides a sterile field where the equipment and hands will be placed, and it prevents accidental contamination from adjacent areas.
Next, prepare the urine receptacle and insert the urine drainage port of the catheter to the inflow port of the urobag. Insert the syringe with sterile water to the balloon port of the catheter.
Lubricate 1 to 2 inches of the catheter tip and avoid clogging the lumen.
Lubrication facilitates the insertion of the catheter and reduces trauma to the tissues.
This tubing facilitates in connecting the catheter to the drainage system. With dominant hand, disinfect the meatus twice using cotton balls with betadine.
Cleansing the area minimizes the risk of urinary tract infection by removing surface pathogen.
With the thumb and forefinger of my non-dominant hand, spread the labia and identify the urinary meatus, and maintain the hold until the catheter has been inserted. Next, insert the tip of the catheter into the meatus below the clitoris, and insert 2 to 3 inches or until the urine will notice in the urine bag. Tell the patient to take a deep breath to relax the sphincter.
If the sphincter relaxes, it is easier to the catheter to insert into the bladder.
So since we use Foley catheter, we have to introduce 10 to 5 cc of distilled water, and with this I am using 5 cc distilled water. That depends on the manufacturers of catheter. Gently introduce.
Next, with that, gently pull the catheter until retention balloon is snuggled against the bladder neck, which indicates resistance is met. Creating a balloon ensures catheter retention, maximizes continuous bladder drainage, and if there is proper attachment, it can prevent trauma to the urethra and meatus from tension on the tubing.
If the urine is noticed in the drainage bag, put the urobag below the bed. It is to avoid the reflux of urine to avoid urinary tract infection. Like this. As much as possible, put it in immobile part of the bed. Now, place the client in a comfortable position.
Wash hands thoroughly. It is to prevent the spread of microorganisms. After that, label the urine specimen and send it to the laboratory immediately. Keeping the urine in room temperature may cause the organisms to grow if there is any, and this could distort the laboratory findings.
After that, carefully record the time of the catheterization, the amount of urine removed, and the description of the patient's urine. You also have to include the reactions of the patient during the procedure or any other observations during the procedure.
A careful record is important for documenting data, and all these reports must be accurate and timely for continuity of care.
First thing we have to do prior to the removing of indwelling catheter, we have to check the doctor's order, because removing of indwelling catheter cannot be done without order from physician.
Do hand washing. It is to prevent the spread of microorganisms.
After hand washing, we have to use sterile gloves, absorbent towel, and 10cc syringe. With the ticket, call the client's name and identify it by checking the identification band of the client.
It is to ensure the right client and elicits cooperation.
Next, don gloves.
Putting sterile gloves helps to avoid cross-contamination of microorganisms.
Place the absorbent towel under the mattress and under the catheter.
This is to protect the bed linen from moisture and getting soiled.
Attach the syringe to the balloon port of the catheter. And withdraw all the fluids that we introduced earlier. Hold the absorbent towel with non-dominant hand in front of the perineum. Next, pinch this part near the meatus using the dominant hand and pull it slightly out into the absorbent towel until the end is retrieved. Hold it in an upward motion so that the urine will drain into the urobag. Inspect the catheter to make sure it is intact. In case if it's not, notify the physician immediately. Measure the output in the urobag and record the output in the in and output of the patient sheet. Discard the urine into the toilet bowl and put it in a right bin.
Then remove and discard the used gloves. Do hand washing to prevent the spread of microorganisms.
After that, document the time of removal, including the time in which the patient should have his or her next boiling time.
A careful record is important for documenting data after the client's care, and all these records must be accurate and timely for continuity of care.